Okay, these are the bones of the appendicular skeleton. So the pectoral girdle, which is composed of the clavicle and the scapula, are what connect the upper appendages to the axial skeleton, and the upper appendages connect with the pelvic girdle, or excuse me, the pectoral girdle at the glenoid cavity. The head of the humerus fits into the glenoid cavity like the ball and socket joint. So what composes the pectoral girdle is the clavicle right here. This is the sternal end of the clavicle, and this is the acromial end of the clavicle. And then the scapula right here. And the structures on the scapula are the coracoid process, the subscapular fossa, which is in here, the glenoid cavity, the spine of the scapula, the acromion, the supraspinous fossa, the infraspinous fossa, and then on the clavicle we have the sternoclavicular joint and the acromial clavicular joint. Alright, so now the upper appendages include the arm, which has the humerus, and right here is the head of the humerus. Right here is the greater tubercle, and right here is the lesser tubercle. Right here is the deltoid tuberosity, the medioepicondyle, right here, the lateral epicondyle is right here. The coronoid fossa is right in here, and then on the other side is the olecranon fossa, and these are depressions which allow for the ulna to flex and extend. Also, we have the capitulum, which is right here, and it articulates with the radius, and the trochlea articulates with the ulna. Alright, so on the forearm, right here is the ulna, and on the back side, where the elbow is the olecranon. Right here is the coronoid process, and on the back of the ulna is the styloid process. This one right here is the radius, the head of the radius. The radial tuberosity is this right here. And then right here is the styloid process on the radius. Okay, so now for the carpus. The proximal row consists of the scaphoid, the lunate, and the triquetrum. And these are the bones that articulate with the radius to form the wrist joint. Then the distal row, and then right here is the pisiform. The distal row is comprised of the trapezium, the trapezoid, the capitate, and the hamate. And the trapezium is the bone that forms a joint with the pollex, which is the thumb. And then right here are the metacarpals and the phalanges. So now I'm going to point out the bones of the pelvic girdle. And the pelvic girdle, like the pectoral girdle, connects the lower appendages to the axial skeleton, and the lower appendages connect with the pelvic girdle at the acetabulum, which is helps form the ball and socket joint with the head of the femur. So on the two coxal bones, we have the ilium, the pubis right here, and the ischium, which is that region right there. And right here is the pubic symphysis, the obturator foramen, the iliac crest, the anterior superior iliac spine, the iliac fossa, then we have, let me turn it, right here is the greater sciatic notch, the ischial spine, and right here is the ischial tuberosity. Okay, so this is the femur with the head of the femur right here, the greater trochanter, the lesser trochanter, the adductor tubercle, the medial epicondyle, the lateral epicondyle, and then behind is the medial condyle, the lateral condyle, and then right here is the patella where the kneecap is. Okay, so on the lower leg, this bone is the tibia, and on the tibia we have the medial condyle and the lateral condyle, the tibial tuberosity, and then down here is the medial malleolus. Up here is the proximal tibiofibular joint, and then down here is the distal tibiofibular joint. Right here is the fibula right next to the tibia. This is the head of the fibula, and then the lateral malleolus. Now down to the feet, or the tarsus, we have the talus, which articulates with the tibia, and then the fibula superiorly. The calcaneus, which is the heel down here. The cuboid bone, which is right here. The navicular bone right here. The medial cuneiform bone is right here. The intermediate cuneiform bone is right here, and the lateral cuneiform bone is right here. The metatarsus are right here, and the phalanges are right here, and then the hallux is the big toe.